Hi, my name is Jacob. I'm the Director of Operations for Arte Dental, and I want to make a video to kind of show you what to expect from Invisalign, how it works, and I'm going to show you guys an extreme case so that whatever it is that you're interested in fixing is probably going to look fairly easy compared to what we do with this particular case. So, first off, Invisalign aligners, basically clear trays or an appliance that you put on your teeth. You do wear it about 23 hours a day. You take them off to eat and brush, obviously, and that's about the only time that these will be out of your mouth for the duration of your treatment. I've done Invisalign myself, and it's really not that big of a deal. They're not super painful the way brackets and wires are. However, I will warn you that the first tray, first couple days you have it, your teeth will be a little bit sensitive, but beyond that, usually not too big of a deal. So, our patient here is a female in her mid-30s, and she has an extra tooth that grew between her two front teeth. That's the main thing that this patient was concerned with fixing. And so I'm going to show you some before and after pictures so we can see how Invisalign did that. So before, after, obviously. Here's a nice close-up of her teeth. You can see that the extra tooth that grew into place, this lateral here is kind of pushed in a little bit, canine's pushed out a little bit. So she's got a few things that, need to be corrected. This tooth is kind of tilted in a little bit. So there's definitely, aside from this, there are some things that need to be corrected. So let's see how Invisalign can resolve those issues. All right. So first I'm going to show you kind of a key. So this green shows how much space there was. So the nice thing about Invisalign with it being digital is that we were actually able to scan the patient with our 3D iTero scanner, send it to Invisalign while she still had the tooth in place, and say, hey, this is what we want to do. We'd like to remove this tooth, but the patient wants to see the results first. So they are able to digitally remove that tooth, and now they're going to show us the before, during, and after of treatment. And so the next thing I want to talk about is attachments. So these little red dots or blobs that are on several teeth, these are called attachments. They're kind of serve the same function as the brackets and wires on Invisalign in that they give the plastic tray, the aligner, something to kind of grab onto to help it twist or turn or pull or push or rotate the tooth. They are tooth colored. We use filling material that's very close to the color of your teeth. And then when you're done with your treatment, we just either pop them off or shave them off. So they're not a big deal. They're not super noticeable. People aren't going to really see them in your mouth unless they're a dentist or if they're just way too close to your mouth. So the last thing that I want to discuss, which is very important, is these gray diamonds down here at the bottom. And these are representing IPR. IPR stands for interproximal reduction. And so what that means is that we're going to have to go through and where each one of these are is we're going to have to reduce just a little bit of tooth structure. So basically we use something kind of like sandpaper and just kind of file down a little bit in between these two teeth. And the amount is extremely insignificant. It's not anything that's going to cause sensitivity or pain. In fact, we don't even numb you for it. Absolutely no need to numb a patient for this. We literally just take a little piece of sandpaper and just file off. So in this particular case, 0.3 millimeters, so it's a third of a millimeter, but that's distributed between these two teeth. So it's actually only 0.15 millimeter here and 0.15 millimeter here. So, I mean, we're talking about maybe the thickness of, one or two pieces of printer paper stacked on top of each other. Not very much. So don't worry about the IPR, but one of the purposes of this video is so that, you can make sure that this has been explained to you, and there are some people that just don't want that done. 99% of our patients are okay with it, and then there's the small percentage that don't want it. Sometimes we can do the cases without any IPR. For example, if you have a bunch of space already, we don't need the IPR to help with the spaces. The IPR is to help when there's crowding in the teeth. So in this particular case, these teeth are kind of edge to edge. The bottom should be inwards, and actually this one, it's just kind of hitting right here on these two teeth. So what we want to do is we want to bring these bottom teeth inwards to where they kind of tuck underneath the top teeth, and that's the natural correct position. And so by creating tiny amounts of space, 0.2, 0.2, eventually that adds up to roughly 2 millimeters, 3 millimeters, just depending on how much of the IPR is being done. And by doing that, it allows all of these teeth to kind of shift inwards towards the tongue a little bit more. So I'm going to hit play, and we're going to watch the transition of beginning, during, and after. This particular patient, if you notice down here, has 23 total trays. Each one is in the mouth for about 2 weeks. So we're looking at about 46 weeks of total treatment. One thing I do like to point out as well is that, especially on a more complicated case like this, I would not be surprised if when we get to tray 23 or maybe even to tray 10, if some of these teeth are not moving the way that they're supposed to. Maybe we're asking that tooth to move a little bit faster than what it really can do. And so let's just say that we got to tray number 10 and this guy over here is not moving the way it's supposed to. That would cause the trays to not fit properly right here. And so we would basically just scan you like we did at the beginning, send that to Invisalign, and let them know, hey, this tooth is not tracking the way it's supposed to. We need to do refinement. But in this particular patient, she actually got through tray 23 and looked very, very close to this. I will say that we did, I believe, 2 additional refinements for her. So once she got through with tray number 23, we scanned her again, tweaked a few things. I didn't like how this was positioned when it was all said and done. For cosmetic purposes, we just kind of smoothed this tooth out a little bit, rounded here and kind of flat there, so we made those match. We whitened her teeth. But yeah, just between Invisalign and just some real minimal stuff, we were able to get the patient from this to that, and it was literally a life-changing experience for her. And just real quick, I will show you guys, kind of what this movement looks like from this view. So on the bottom, you can kind of see what I was talking about, how the teeth have to come inwards, and that's why we created that little space with IPR. Again, not a whole lot, but it was needed to properly tuck the teeth in the way that they should be, which you can see here. So before, everything was kind of edge to edge and just wearing down the tooth surface here and wearing these out. And when we're done, we've got her in a pretty close to perfect bite, so you can kind of see everything's all nice and tucked in. The top, that's the fun part. So here's before, during, and after. So thank you again for your time, for watching this. Again, I know that 99% of our patients are not going to have cases that are this complex, but I like to use this one, just to kind of show off a little bit. Dr. Nguyen is the one that completed this case, and he did an amazing job, and patient, doctor, myself, everybody was extremely thrilled with the outcome. But I also like to show this because this is definitely one of the more complicated ones, and I believe that there's a little bit of a misconception about what Invisalign is capable of doing, how much or how little. And so I like to show this to, show, hey, Invisalign can really fix some, what we call maybe a crossbite or, a really large amount of spacing. And so we hope that your Invisalign is something that you're excited about, because aside from the cosmetic in this particular patient's case, she had issues that would cause premature wear to her teeth and quite possibly cause tooth loss at a much earlier age than necessary. So aside from just, making her smile pretty, it also serves a very functional purpose as well. Thank you for your time, and hope you enjoy the rest of your day.